Hi guys, welcome back to my channel. My name is Lara. In this video I would like to be sharing with us how we can treat colic in newborn babies. This colic is actually what some people know as inniwo. It's actually a situation whereby a baby that is neither sick nor hungry cries for like maybe 3 hours in a day or like 3 days in a week. You just see babies crying for no just reason. At times even mothers get worried. They don't know what to do. They try a lot of things, and once they hear that it is a colic that is disturbing the baby, they get a whole lot of things. They get what's it called? They get nospamin, they get gripe water, they give the baby a whole lot of things, and most times all these things actually have their own side effects. Today I would like to be sharing with us few things that we can do at home in order to reduce the level of the colic in baby, or to even put an end in order to eliminate colic in our babies. So what do we do? Number one, I want to let us know that this colic don't happen to any child. It can happen to any child. Even for a particular mother, it can happen to a particular child, and it will not happen to another child. And some people even believe that it happens mainly to male child. No, this is not correct. It actually happens to all gender. It can happen to a boy, it can happen to a girl, it can happen to a breastfeeding baby, and it can happen to a bottle-fed baby. It can happen to just any baby. Even doctors did not even know. Doctors, they didn't even know the cause of the colic, but there are a lot of things that we can actually do at home, even without administering any kind of drug to our baby. And before you know it, you will discover that the level of the colic will be reduced, or you just see that your baby is not even having it at all. And let me shock you, this colic that we're talking about is even a kind of, let me say, a mindset. Some women, they've been prepared ahead that even when they are pregnant, they've had it that when they give birth, baby normally have colic, as in the baby will just be crying, the tummy will be turning the baby, and they are already envisaging, they are already awaiting when that kind of thing will start. It actually starts like 2 weeks of baby's age. Like 2 weeks after the birth of a baby, one will start noticing this kind of thing. But what I'm trying to tell you is that some people, they put their mind to see that thing happening to a baby, and before you know it, it will surely happen. I can tell you for sure that in my own first child, I did not even notice anything like colic. At another time, someone was asking me that, do your baby have colic? I said, no, there's not that. It used to happen to baby. And you believe that I was even awaiting it. When I had a newborn, I was awaiting it, that what is the colic? Is it going to happen to baby or not? And before you know, you will see that your baby will have it. If you just put your mind that your baby is not going to have any kind of pain, you will see that you will not experience it. And so people even use what they call, what is it called? Orogiri. There's something they call orogiri. There's this ogiri. It's just like, it's not really locust beans, but it's somehow similar to locust beans, but it's more smoother. Like it has been grounded, it has been blended. It's more smoother than the normal locust beans. They call it ogiri. The Igbo people do sell it, and some people call it ogiri jebu. So there's this oil that normally come on when they are producing this ogiri jebu. When they are producing that ogiri, there's this oil that normally is just like when you are doing groundnuts and you want to do kuli. There's this oil that will come out of the kuli. Some people like it, they prefer it compared to all these imported groundnut oil, vegetable oil that we use. So they prefer all this groundnut oil so the same thing with this ogiri. When they are producing, there is this kind of oil that normally come out of the ogiri. So this is what some people give babies. They believe that when baby take this kind of thing, it helps the baby to fat, because they believe that it is God that is being trapped in the baby's tummy that made that colic to happen. So when they administer this ogiri, this ororogiri, they say it helps the baby to fat and thereby expelling the gas in the tummy, thereby giving the baby a kind of relief. But I believe I've used the ororogiri for baby. I'll tell you that I didn't even see any kind of change. The baby will still continue to cry. So mother herself, it will get to a stage that they will not know what to do again, and the mothers too will start crying. See, today I'll give us some simple tips that will help us to relieve our baby from colic pains. Number one of them is warm baths. When you see that your baby is crying non-stop, the baby is neither sick, the baby is not running temperature, and the baby is not hungry. See, get your baby bathing tub, fill it with warm water, put the baby inside warm water, and be pouring just lightly be pouring the water on the baby's body. Be pouring the warm water on the baby's body, and if possible, that warm water, you can actually use your hand in that warm water and be rubbing the baby's tummy in a circular motion. Just be rubbing the baby's tummy, and the baby will be relieved. There was a time that my baby was having that pain. It's been a long time anyway. So the baby was having the pain. So the pain was just so much unbearable that I have to call a doctor friend. That what drug should I buy? And she told me that I should not buy anything. That I should just lay the baby. That once the baby has finished eating, when I finish breastfeeding the baby, I can either put the baby on my shoulder and be rubbing the baby's back, or put the baby on your lap. In fact, if you are so sensitive, if you put your hand on the baby's tummy, you will be hearing a kind of sound that will be doing in the baby's tummy. All you have to do is just to rub the baby's tummy. So if you put the baby in a warm water and you are pouring that warm water on the baby's body, and you are using your hand to rub the baby's tummy in a circular motion, before you know, the baby will be relieved. And another one is called warm compress. This one, you just get a bowl, put warm water inside it, put a towel, squeeze out the excess water, and use the warm towel, press it on the baby's tummy. Do this continuously. You can do this, and the time that this thing normally happens to children is around evening time, like 6 to like maybe 10 p.m. to 12 a.m. Just continue. You just that in the evening your baby will just be crying. So these are the kind of things you just do. Just get warm water, put your soft towel in it, strain out the excess water, and use the warm towel to rub your baby's tummy, and the baby will be relieved. Another thing is you can also do is oil massage. Get olive oil, rub it in your palm like this, rub it very well on your palm, and generate a kind of heat, and then continue to rub it in the baby's tummy, and before you know it, the baby will be relieved. Another thing is that you should try and bob the baby. Anytime you be finished eating, put the baby on your shoulder and continue to bob the back. Just be rubbing your hand on the baby's back, and ensure that the baby either belch, as a release hair from the mouth, because we believe that it is hair that is being trapped in the baby's tummy that make the baby to have colic. So most time when baby bob or belch or fart, they kind to get relief. So try and make sure that each time you feed your baby, you bob the baby very well. Just put the baby on your shoulder and continue to rub the back. And even if it's in the middle of the night, once you breastfeed the baby, just make sure that you put the baby on your shoulder and continue to rub the back until you see that the baby has belched. Then you can now put down the baby. Another thing you can do is that you can cuddle the baby. Just cuddle the baby, play with the baby, move around with the baby, and the baby will get relieved. Another thing, you can just carry the baby and move around, or you back the baby and move around. You can dance, you can sing and talk softly to the baby. Talk to the baby, tell the baby that you don't have to have pain, there will not be pain in your body. Say little things, just say it gently to the baby, and before you know it, you see that the baby will be calmed and the baby will not feel pains again. Another thing is that if you have all these swinkler, all these rocker that has a sound or something, just put the baby on the rocker and continue to rub the baby. Rub the baby very well. Be playing with the baby. You will see that in no time, all these pains will be gone, even without taking any kind of medication, even without giving your baby things that will have side effects. Some people, they will be giving us, I mean, they will be giving drip water or upon drip water. Once the bottle finish, they go and get another one. They continue giving the baby, and the thing is that you at the end of it, you might not even see that this thing is actually working. So with this little thing that we do to our baby, we rock the baby, play with the baby, sing, do a lot of things to comfort the baby, and before you know it, all the pains will be gone, and there will not be anything like colic pains in our babies. Here I stop today. If you enjoyed today's video, kindly give a like, give a share, give a thumbs up, and don't forget to subscribe to this channel. Thank you, and God bless you, and I'll see you in the next video. Bye for now.